For over 70 years, ACPM has been at the forefront of prevention science. Translating research into practice and shaping national policy. On any day across America, nearly 2,000 members of the college are hard at work shaping the nation's health. At the center of our health ecosystem, the college's strong foundation spans the decades. From its founding members, who helped aviation medicine take flight and developed the polio vaccine, the shot felt around the world. They've created the safest conditions to send astronauts to space, drew the first link between smoking and cancer, and helped issue the nation's first nutritional guidelines.
If we address root causes of chronic disease and premature death, we can enhance overall vitality, increase the prospects for longevity, and prevent the development of cardiometabolic diseases.
From surgeon generals to the founders of the U.S. Preventive Services Task Force, the college's members have helped build to a new era.
I founded the U.S. Preventive Services Task Force because there was a clear need in order to expand preventive services to develop an evidence-based assessment that was irrefutable.
We're in a phase right now where we may be moving away from the historic sick care system into a well care system.
We've got to reverse this epidemic of chronic diseases due to chronic systemic inflammation with behavior change and environmental changes. Who better to do that than preventive medicine physicians who are clinically trained, understand the science, understand practical approaches to help physicians deliver that care.
Building bridges between public health and clinical medicine.
One of the advantages that the American College of Preventive Medicine has is that many of its members already work in governmental agencies and are able to break down the barriers between prevention and politics.
We also have long-standing relationships with National Institutes of Health, the Food and Drug Administration, and in particular, the Centers for Disease Control and Prevention. Working together is critical because that's how we can drive policy effectively. Our voice is much stronger when we work together.
And helping to build the National Diabetes Prevention Program from the ground up, spreading it to communities who need it most.
We trained non-clinical leaders a set of skills, how to communicate around diabetes prevention. It was some of the most fulfilling work that I've ever been a part of.
Well, one of the programs that we've been able to develop is actually taking the diabetes prevention program and tailoring it to women who have been diagnosed with gestational diabetes, who, as we know, are at very high risk of diabetes in the future.
Watching small changes create big momentum.
If you can prevent childhood illnesses, you can prevent childhood deaths due to vaccine preventable illnesses. If you can prevent smoking to encourage people to quit smoking, if you can encourage people to live a healthy lifestyle.
For preventive medicine physicians, it's about population care.
And it's a worldview, a way of thinking that we're not just focused on how do I treat one person. We can, and we're good at it. But we're also focused on how do I treat everyone in a community? How do I treat everyone in the state? How do I treat everyone across the globe?
And making sure prevention is front and center in both practice and policy.
I think that there's value in bringing forward stories and individuals and anecdotes where they back up the evidence and the scientific case that you're trying to make. So when my colleagues are sitting there deciding whether to vote for something or not, it's not usually the numbers that they remember, it's the witness that came up at the table, and that's how they're choosing to vote.
ACPM works to support its members in connecting the systems, communicating the latest evidence, and acting to protect populations in the face of the nation's biggest threats. And during the largest health crisis of our generation, ACPM members helped keep hospitals open, provided leadership at local, state, and federal levels, and educated the public on what it would take to bring the pandemic to an end.
During the pandemic, the college truly galvanized our members around the tenets of prevention. From emergency preparedness, dealing with the broader community issues that go beyond the individual patient level, understanding the role of vaccinations.
From the halls of academia to corporate America, and on the front lines around the globe, protecting our active military and veterans.
The military has always had a primary emphasis on disease prevention and health promotion because its primary product is a fit and healthy, ready force. And that begins with prevention.
Young men and women who operate the Air Force aircraft and other systems, you're looking after their health, first order, but you're also looking after their safety in an occupational sense and a flight medicine sense, but also in a general community public health situation to ensure that the troops and in some cases families are healthy in that environment.
ACPM has not just witnessed America's health history, it has helped write it.
I think that we bring a greater rigor to our understanding, both in depth and breadth, of the potential for preventive interventions, that we really have a leadership role to play in.
Learning lessons that create impact.
When you come to a table, whether it's a political table or a business table, you don't just bring your medical mind. You have to understand the entire discussion, how you create value in a business, how you create value in a society. And if you just wait for the medical question, you'll miss out on so many other opportunities where preventive medicine could have really helped.
Today, from new tech systems to the advent of AI and preventive medicine's new membership in the match, a whole new generation is joining the ranks to protect the nation.
The future of preventive medicine looks very bright to me. It's because medical knowledge and medical technology are so rapidly advancing.
The college has a great opportunity to step in and really move the country forward on how do we think about prevention in an intentional way.
There are too many challenges, they're too diverse, they're too nationwide, so we need a home. And that home, of course, is the American College of Preventive Medicine. We've been at the forefront of disease prevention since the middle of the century and proud to claim it.
The American College of Preventive Medicine is my primary professional home. It's my family.
ACPM, more than 70 years of proven prevention, leadership for a healthier tomorrow.